Unlike a lot of people in my class, I never actually needed physical therapy. Instead, I was introduced to it in 5th grade during career day. From that moment on, I knew I wanted to be a physical therapist because it combined my love of science with my love of helping people. I saw how physical therapy could change the lives of people that I knew who needed it. I also saw how it could influence the lives of the children with disabilities that I worked with. Coming to UWM was kind of a last-minute decision for me. It started 10 days after my graduation from undergrad, and I was unsure if I could handle that stress load. After touring the campus and learning about the small class sizes and the early patient contact, I decided that UWM was right for me. Looking back on it now, it's the best decision that I ever made. This is a tough question, but personally, I believe that your didactic education and your clinical experiences hold fairly equal weight. You can't have your clinical experiences if you don't have your didactic background. Your didactic education is imperative so that you know everything there is to know about the profession and how to treat a patient. But there are definitely things that you can't learn from a didactic education that you can only learn from your clinical experiences, such as how to interact with certain types of patients. Therefore, I think your clinical experiences are invaluable. Although I think UWM does a really good job of integrating patient contact in these first few years of the program, I still think that your clinical education is completely necessary to becoming a good PT. The first quality I would choose that makes a therapist great is good communication. You have to be able to communicate with your patients and understand what they're telling you and be a good listener. You also need to be able to dictate to them what you're doing to them so they can understand what kind of care they're receiving. The second thing that I would choose is continuing education. As physical therapists, our field is always changing and growing, and we need to stay on top of these new developments in order to give the best care possible. The third thing I would choose is creativity. I used to volunteer with children with disabilities, and I saw firsthand how these children were not textbook cases, and the physical therapists that work with them really needed to be creative in how they treated them, trying new things and doing new tests and fitting different devices than they would normally use. Creativity will help you be a better therapist. I would think that patients would agree with these 3 things. Although they might have some of their own, these 3 things are definitely crucial to being good at physical therapy. A book that I recently read that really resonated with me is called The Spirit Catches You and You Fall Down. It's about a Hmong family that lives in the US with their daughter who's having some major seizures and medical problems. The medical system here tries to help her, but the parents don't really believe in Western medicine. And there's a huge cultural barrier which doesn't promote trust between the family and the doctors. There's also a giant language barrier. For me, it really struck a chord with everything else that we've studied this summer about how to deal with cultural differences and language differences and ethics when someone doesn't want you to give treatment to their son or daughter who is a minor. I thought it was really interesting to see how these things were portrayed in the medical field, in a true story. In undergrad, I worked in a psychology lab where I did research on stereotyping and prejudice. So for me, racial differences, cultural differences, homosexuality, all these issues to me are very important and very interesting. Working in a health field or in any field that deals with people, you encounter stereotypes and prejudice every day. As a PT, I really hope that I can help to minimize these things in my practice. But no one knows. I just found out. As I mentioned before, I worked in a psychology lab during my undergraduate studies. I double majored in kinesiology and psychology, and I find the psychology aspect of physical therapy extremely interesting. I truly believe that mind and body are intertwined and that you can't know one fully without knowing the other. For me, I would love to advance the profession by integrating my knowledge of psychology with the PT knowledge that I'm learning now. I think that having a background in psychology will make me a better physical therapist. In order to get back to the field of physical therapy, I would want to be an active member of APTA and WPTA so I can make sure that my voice is heard. In addition to that, I would also want to be a general advocate for health and wellness and promote those lifestyles within my community.